Hi there, let's talk about IPR. What is IPR? IPR is otherwise known as Interproximal Reduction, which means reducing the amount of enamel between the teeth. This is done in orthodontics and has been done for many, many years. When we look at it, people get very concerned that we're going to be chopping the teeth. We're looking at 0.5 or 0.6 of a millimetre as a maximum. That's less than a fingernail width. And if we look at the anatomy of the tooth itself has approximately 1 millimetre of enamel on each side. So to borrow 0.2, 0.4, or even up to 0.6 of a millimetre is not very much. But what does it allow us to do? If we can borrow up to 0.5 or 6 of a millimetre around a dental arch, we can avoid an extraction and we can allow the teeth to move as we need and want them to move. So let's look at straightening teeth with IPR and without IPR. If we straighten the teeth with IPR, the teeth are straightened in the arch as they are. If we straighten them without IPR, then they are brought forward. They have nowhere else to go. This is highlighted by the superimpositions, which shows the finishing positions of the teeth with IPR are well within the arch, and the finishing positions with no IPR are out further than where they were at the beginning. Now, that might be fine. However, if we look at the top teeth, straightening the teeth with IPR and no IPR is very different. If we straighten them with IPR, you can see that the teeth, the front teeth, all the teeth are straight and there is no space at the front. Where we do no IPR, we can see that there's a space distal to or behind the lateral incisor teeth, and then you have to accept that or build the teeth up, which demonstrates here the differences and why we need to reshape the teeth. It is completely non-invasive. Okay, let's cut to a short video, and while that video is playing, what you'll see is the two methods we use to do our IPR. What you're seeing here was an initial demonstration of using a strip, a hand strip, which gives us ultimate control. And then this is followed with a reciprocating handpiece. And these saws that we use are diamond grit saws, and we have control of 0.1, 0.2, 0.3 millimetres. And they don't cut, we don't need anaesthetic, there's no sensitivity, and it's perfectly safe. In fact, studies show that in some instances, polishing the enamel between the teeth makes it even smoother than it naturally was. So that when we ask permission to do IPR, you can be assured that it's safe and it's productive and it's so useful and gives us so much more ability to move the teeth and create the outcomes that we need to. Thank you.